Did you know that Strattera, a non-stimulant ADHD medication, can take up to 8 weeks to reach its full effect? Unlike the quick-acting stimulants, Strattera plays the long game. But is the wait worth it? Let's find out. Strattera stands out in the ADHD medication landscape. It's not your typical stimulant like Adderall or Ritalin. Instead, it's actually a failed antidepressant that was repurposed to work in the ADHD because they found that it helped people with attention, motivation, and memory. But here's the big question. Can Strattera match up to stimulants in managing ADHD symptoms? And what about its side effects? And who am I to walk you through this? My name is Dr. Sulman Aziz Mirza, triple board certified in adult psychiatry, child and adolescent psychiatry, and addiction medicine. And Strattera is a medication that I probably get asked about the most, but prescribe the least. Now that we've introduced Strattera, let's explore how this medication actually works in the brain. Unlike stimulants that target multiple neurotransmitters, Strattera has a more focused approach. It's classified as a selective norepinephrine reuptake inhibitor, or SNRI. But what does that mean for your brain? Imagine your brain as a bustling city, with the neurotransmitters acting as messengers, zipping around delivering important information. Strattera's job is to keep more of these messengers, specifically norepinephrine, in circulation. It does this by preventing the reabsorption or reuptake of norepinephrine. This increase in norepinephrine is hypothesized to help improve attention, motivation, memory, and learning. One key difference between Strattera and stimulant medications is its effect on dopamine. While stimulants significantly boost dopamine levels, Strattera has minimal impact on this feel-good neurotransmitter. This characteristic is crucial because it's what makes Strattera totally non-addictive. However, the way Strattera works also means it doesn't provide instant relief. Unlike stimulants that can kick in within an hour, Strattera takes its time. The initial therapeutic effects of atomoxetine usually take 1 to 4 weeks to become apparent, and a further 2 to 4 weeks may be required for the full therapeutic effects to be seen. This means you might need to wait 4 to 8 weeks to experience the full benefits of Strattera. While this gradual onset might seem like a drawback, it comes with some significant advantages. For starters, Strattera provides continuous symptom relief over 24 hours as Strattera maintains a steady level of medication in the body throughout the day. This means you don't have to worry about medication wearing off mid-afternoon or needing multiple doses throughout the day. Another major benefit of Strattera is its suitability for people who can't tolerate stimulants. Some individuals experience uncomfortable side effects from stimulant medications or have other health conditions that make stimulants risky. For these people, Strattera offers an alternative path to managing ADHD symptoms. Strattera's non-addictive nature also makes it a possible option for individuals with a history of substance misuse who may not want to use a stimulant. Since it's not classified as a controlled substance, it can be a safer choice for those who are in recovery or at risk of misuse. But what about some potential drawbacks of Strattera? Like any medication, Strattera isn't without its challenges. While it offers unique advantages, it also comes with potential side effects that users should be aware of. Let's take a closer look at what you might experience when taking Strattera. Common side effects of Strattera can include abdominal pain, appetite loss, and fatigue. These symptoms are typically mild and often improve over time as your body adjusts to the medication. For children and teenagers, additional common side effects may include nausea, vomiting, and dizziness. However, it's important to note that Strattera can also cause more serious side effects in some cases. One area of concern is its potential impact on liver function. In rare instances, Strattera has been associated with severe liver injury. Signs to watch for include itching, right upper belly pain, dark urine, yellow skin or eyes, or unexplained flu-like symptoms. If you experience any of these, it's crucial to contact your doctor immediately. Heart-related issues are another potential concern with Strattera use. There have been reports of sudden death, stroke, and heart attack in patients with pre-existing serious heart problems. Additionally, Strattera may cause increased blood pressure. Because of these risks, your doctor may recommend monitoring your heart rate and blood pressure during treatment. Perhaps the most significant concern with Strattera is the risk of suicidal thoughts and behaviors, particularly in children and adolescents. This risk is serious enough that the US FDA has issued a black box warning for Strattera, like all antidepressants, which remember, Strattera originally was designed to be. This is the FDA's strongest warning. used to call attention to serious or life-threatening risks. The FDA's decision to issue this warning was based on the findings that Strattera has a 0.4% incidence of new suicidal thinking compared to none in placebo groups. While this percentage may seem small, it represents a significant increase in risk that cannot be ignored. If you or your child are taking Strattera, it's crucial to be aware of signs that may indicate suicidal thoughts. These can include new or worsening mental health symptoms such as anxiety, hearing voices, agitation, panic attacks, trouble sleeping, irritability, hostility, aggressiveness, or depression. If you notice any of these symptoms, it's important to seek medical help promptly. It's also worth noting that individuals with a history of suicide, bipolar illness, or depression should inform their doctor before starting Strattera. The medication can potentially cause mania or worsen existing behavioral problems in these cases. Despite these potential risks, it's important to remember that many people take Strattera without experiencing serious side effects. Ultimately, the decision to use Strattera should be made in consultation with a healthcare provider, weighing the potential benefits against the risks. While the side effects and warnings may seem daunting, for many people with ADHD, the benefits of symptom management outweigh the potential risks. How does Strattera stack up against the more commonly prescribed stimulant medications? Let's pit it against popular stimulants like Adderall and Ritalin in a head-to-head comparison. First, let's talk effectiveness. While Strattera has shown promise in managing ADHD symptoms, stimulants generally take the lead in this arena. According to Attitude magazine, generally speaking, stimulant medications are significantly more effective than Strattera for treating ADHD. This doesn't mean Strattera isn't effective, but rather that stimulants often produce more noticeable results for many patients. One key difference between these medications lies in their onset of action. Stimulants are known for their quick effects, often kicking in within 30 minutes to an hour. Strattera, on the other hand, takes a more gradual approach. It can take 1 to 4 weeks for initial effects to become apparent, with full benefits potentially taking up to 6 weeks to manifest. This slower onset might be frustrating for those seeking immediate relief, but can also mean more consistent management over time. When it comes to side effects, both Strattera and stimulants have their own profiles. Strattera is often associated with nausea, fatigue, decreased appetite, and dizziness. It also carries a black box warning for increased risk of suicidal thoughts in children and adolescents. Stimulants, meanwhile, are more likely to cause insomnia, decreased appetite, increased heart rate, and in some cases, anxiety or irritability. One significant advantage Strattera holds over stimulants is its non-addictive nature. Stimulants, due to their impact on dopamine levels, have a high potential for misuse and are classified as controlled substances. This means they require stricter regulation and can be problematic for individuals with a history of substance misuse. Strattera, in contrast, doesn't affect dopamine in the same way and doesn't cause the euphoria or the high associated with stimulants. This difference in addiction potential makes Strattera a safer option for certain individuals. For example, those with a personal or family history of substance misuse might find Strattera a more suitable choice. It's also worth noting that Strattera's non-controlled status means it's often easier to obtain prescription refills compared to stimulants. It's also important to remember that individual responses to medication can vary widely. What works well for one person might not be as effective for another. Some individuals may find that they respond better to Strattera than to stimulants, or vice versa. Others might benefit from a combination approach, using both types of medication under careful medical supervision. We've compared Strattera to stimulants, but did you know that there are other non-stimulant options for managing ADHD? Let's explore some alternatives that might surprise you. Let's start with Qelbree, also known as viloxazine. Like Strattera, Qelbree works as a selective norepinephrine reuptake inhibitor. Because they are so similar, I often refer to Qelbree as Strattera 2.0. One main advantage of Qelbree over Strattera is that for people who struggle with swallowing pills, Qelbree can be opened and its beads can be poured into things like pudding or applesauce, which you cannot do with Strattera. The downside? It's newer and there is no generic available yet, so it can be pricey or not always covered by insurances. Now let's shift gears and talk about clonidine and guanfacine. These medications belong to a different class called alpha-2 adrenergic agonists. They work by stimulating specific receptors in the brain, which can help reduce hyperactivity and impulsivity while potentially improving attention. One interesting feature of clonidine and guanfacine is their versatility. They're often used in combination with stimulants to enhance overall ADHD treatment. This can be particularly helpful for managing symptoms like hyperactivity that may not be fully controlled by the stimulants alone. However, these medications come with their own set of challenges. Clonidine, for instance, is known for causing sedation and drowsiness, especially when first starting treatment. It can also lower blood pressure, which might be problematic for some patients. Guanfacine, while generally well tolerated, can cause similar side effects like fatigue and occasional dizziness. So, when might a doctor recommend one of these alternatives over Strattera? Qelbree could be a good choice for patients who need a non-stimulant option due to history of substance misuse or when stimulants are contraindicated. Its unique side effect profile might also make it suitable for those who struggle with the side effects of other ADHD medications. Clonidine and guanfacine, on the other hand, might be preferred for children and adolescents who exhibit significant hyperactivity and impulsivity. The calming effects of these medications can be particularly beneficial in these cases. While they all aim to improve attention and reduce hyperactivity, they do so through different mechanisms and with varying side effect profiles. The choice between Strattera, Qelbree, Clonidine, or guanfacine often depends on individual factors such as symptom presentation, medical history, and response to previous treatments. We've explored Strattera from all angles, but the big question remains, is it right for you? The answer isn't simple. Strattera's effectiveness varies from person to person. For some, it's a game changer. For others, it falls short. Remember, it takes weeks to reach full effect, so patience is key. Your medical history, lifestyle, and specific ADHD symptoms all play a role in determining if Strattera is a good fit for you. If you can't tolerate stimulants or have a history of substance misuse, Strattera might be worth considering. But keep in mind its potential side effects, including the rare but serious risk of liver problems and suicidal thoughts. Ultimately, the choice should be made with you and your doctor. They can weigh the pros and the cons based on your unique situation. As we look to the future of ADHD treatment, one question lingers. Will new medication offer even better options or not? Thanks for watching, and let me know your thoughts in the comments below. Have you had success with Strattera or potentially a negative reaction? If you found some value in this video, please make sure to like, share with friends and families, and subscribe to the channel for the latest and the greatest in all things mental health. Until next time, stay safe and be well.